high-quality patient care, a seamless workflow, organized, efficient. These are words we would all like to use to describe our medical practice, and they are the words that describe what can happen when team huddles are incorporated into a practice. The term team huddle literally means regularly scheduled short meetings for a practice team. The main goal is to improve your team's ability to work together to ultimately enhance the quality of patient care. Team huddles provide a way to proactively address scheduling, patient, and practice issues. They're helpful in keeping staff members informed and serve as a strategy for ongoing review of your operations. Team huddles are an important part of the patient and family-centered medical home because a medical home provides a team-based approach to care. A medical home is led by pediatricians or family physicians and will likely include nurses, nurse practitioners, physician assistants, medical assistants, office staff, parents, and caregivers, among others. A pediatric medical home works with families to enhance their child's well-being, including physical and mental health. One strategy to building an effective medical home that uses a team-based approach is to introduce team huddles into your practice. A practice may have more than one designated team, but each team generally includes the clinicians and staff involved in caring for a set of patients on a given day. Invite the entire team and hold a meeting every day to go over the day's schedule. Reviewing the schedule can highlight who has availability for additional patients or which staff members are out sick or on vacation for the day. This can be especially helpful to reception staff when scheduling appointments. In addition, talking about the daily schedule gives employees an opportunity to address challenges related to acute care or sick visits, same-day appointments, or complex patients who require extra time for their visit. These discussions allow staff to make the necessary schedule adjustments or other changes before the day begins. Huddles are also useful as a strategy to ensure that everyone on the team is aware of what may have happened with the patient since his or her last visit. For example, were there any specialty consultations, hospitalizations, or visits to the emergency room for acute care? Team huddles also help practice teams anticipate specific patient or family needs for the day, which will result in better organization. For example, your staff can determine whether any testing, immunizations, or prescription refills will be needed, or if lab results and specialty consultation reports are in the patient's chart and ready for their visit. Being more organized can lead to higher quality of care for patients and allow pediatric clinicians to use clinical guidelines more effectively during patient visits. As a result, patient outcomes, care coordination, and overall safety improve. Better organization also enhances patient, family, and staff satisfaction. Families appreciate a well-organized practice, and staff members feel important, being an integral part of a high-functioning team. Plus, improved organization and communication enhance the work environment. In fact, there are several ways that team huddles can do this. They promote open communication and allow time to address staff shortages due to illness, vacation, or emergencies. Huddles also provide the chance to have a brief conversation about sharing a particular task or responsibility that day, or to give quick updates on operations and business functions that may impact patient care or workflow. If you are considering starting team huddles, talk it over with staff members and clinicians. Be sure to explain how huddles can improve the overall performance and workflow, the ability to work together effectively, as well as patient satisfaction. To start, it may be helpful to begin with a small group and expand it over time as necessary. When you're ready to hold team huddles, plan ahead. Figure out what works best for your practice and hold them at a specific time each day. Consider whether it would be better to hold them in the morning before patients arrive or at the end of the day to prepare for the next day's activities. Create a standard agenda to structure your huddles and consider designating one person as the leader and another person to take notes. Be sure to hold team huddles in a central and consistent location and limit the amount of time to less than 15 minutes. Once huddles become routine, you may be able to accomplish your goals in as little as 5 minutes. It's important to emphasize that these are working meetings, but that they will be kept brief. Also, establish a clear set of expectations and objectives and communicate these at the start of the huddle. Encourage everyone to communicate openly and honestly, and stress that everyone's input is important and appreciated. The focus should be on the daily activities and events for the practice, not on resolving business or operational procedures. Be sure that someone brings the schedule for the day, and if possible, provide easy access to patient charts or electronic health records. Review the schedule for patients who may require a longer appointment or accommodations because of special needs or other challenges. Designate someone to help with that patient and make schedule adjustments if necessary. Also, decide who is responsible for checking the schedule for patients who will need a translator or interpreter. Ensure that information, such as lab and test results, is available for review during the huddle. This would also be a good time to check for medical supplies that will be used for patient tests or procedures. Remember that during your team huddles, you have done anticipatory planning for each visit that will be shared with the patient and family when they arrive to ensure that it is consistent with their needs. Flexibility and responsiveness are essential. Team huddles can be useful to every practice. Give this approach a try. There's so many benefits to incorporating team huddles, and it really can be a win-win situation for your practice, your patients, and their families. For additional information, access the resources and tools available from the National Center for Medical Home Implementation. The National Center staff is available to support you and your practice in working to ensure that every child and youth, including those with special healthcare needs, has access to a medical home.